My name is Doctor Anthony Adoge, and I'm the head monitoring and evaluation at the Federal Ministry of Health and Social Welfare. I'm quite excited because today the coordinating Minister of Health and Social Welfare, Professor Mohammed Ali Pate, launched the multi-source data analytics dashboard. And the reason why my colleagues and I and other stakeholders are excited is because it's been a long way. We conceptualized the whole idea of having one single dashboard where we can visualize our population data, our assessment data, and even our admin data all in one place so that it gives us a sense, more insight about what's happening in our health sector to be able to make uh, critical decision as planners. So we started this journey in 2016, and since then, we've been building the multi-source dashboard, um, improving on it through stakeholder collaboration, and we're happy that today this has come to fruition. It is not the end of the journey. Um, there are a whole lot of things that are still coming together, and we're hoping that all stakeholders at all levels, whether it's at the federal level, whether it's at the state, local government, and even facility level, they are able to take insights from the multi-source dashboard and use it for critical decision making. Um, what we hope to do in the near future is to begin to do more inferential analysis and also place them on that dashboard. But overall, make the analysis easier, make the make it more friendly, make it more interactive, so that when people search for health information, they're able to find it all in one place. And we want to thank the minister for uh, giving the MSDAT more visibility. The launch today means that more people become aware of it at all levels. The commissioners are excited, and we employ them at every state level. They should put it on their websites, because the more they use data, the more visible it becomes, the more meaning it makes if people are able to use it, especially at the subnational level. The National Health Facility Registry, I call it the newly redesigned National Health Facility Registry. It's another critical piece of work that we embarked on. And the reason is because we feel it's foundational for, as a country, for us to be able to know the number of facilities that we have, whether it's primary, secondary, or tertiary. But beyond that, we are redesigning the HFRO to be able to reclassify facilities as it should be. And that's what the national health places at the laps of the coordinating minister, that he is the one who is responsible for classifying facilities. So it's not a question of uh, just the services that a facility provides, but there are some other parameters that we are designing into this to ensure that it's able to drive standards in nomenclature of facilities and in the services they provide. Added to that, and a very key feature of this new design is the user interface. So we are building a health facility registry that not only responds to the needs of public health actors, but to the needs of the people. So if you have someone who, for example, needs to get to a facility around here, all you need to do is to click on it, and then it takes you to where that facility is. What's our further vision to this? It is for us to be able to support states to know their facilities. We've been having a problem of local governments not being able to keep an eye on whether they are adding new facilities or able to regulate facilities by either suspending them for infractions and things like that. But with the health facility registry, they are able to do that. And the last piece of this critical work, it's regulation. We need appropriate regulation of facilities. And what we have tried to use this newly redesigned health facility to do is to be able to for states, local government partners, everybody to be able to see at a glance, is this facility assessed? Is this certified or issued with certificates of standards? What are the services that they provide and things like that? And then for those agencies and parastatals and those who are implementing, for example, the NCDC, the NHIA, the National Primary Healthcare Development Agency, all other agencies, the health facility registry should be that single backbone for all data systems. And that's very important so that we are able to keep an eye on all our organizational units in the health sector. Like I mentioned before, my name is Dr. Anthony Adoge, and I'm the head monitor and evaluation and leading the process of designing and redesigning all of this. But I also want to thank eHealth for everyone. They've been providing us a lot of technological support, and also to thank the Gates Foundation, who have been providing financial support, WHO, CDC, AFNet, so many partners, all our agents and parastatals for all their support and contributions. Thank you very much.